So today we're going to do a lip augmentation for Siobhan, and we're going to do that by injecting some dermal fillers. A lot of girls and women, especially older women, are scared of having lip augmentation because you see so many celebrities with the trout pout, where it all looks really exaggerated and it doesn't look nice or natural. So today we're going to be focusing on the techniques that you can use to try and prevent and avoid that. Augmenting the lips can be a really satisfying procedure to do to the face. In terms of balancing the lips with the rest of the facial features. As we get older, we also lose volume from the lips, so adding a little bit of volume back to the lips can make them look a bit more youthful again, but it's really important that it doesn't get overdone. The key thing in making the lips look natural and attractive is maintaining the proportions of the lips. There was a fashion in years gone by to make the top lip as big as the bottom lip, but actually that never occurs in nature. You'll never see it in girls who've had their lips done, so we want to avoid that. You want the top lip to be around about 2/3 of the size of the bottom lip, and you want the majority of the volume to be focused in the central 2/3. Again, you see quite a lot of girls where it almost looks like a sausage going all the way across the entire width of the lip. So to keep it looking nice and natural, most of the volume has to be within this central 2/3 with just a little bit of volume tapering off towards the outsides. Siobhan actually has a really nice shape to her mouth, so we don't want to do too much. We're literally just going to bring the size up by maybe 20-25%. Immediately after having a filler injection, the lips will swell up. They swell up more than any other part of the face, and you have to schedule the procedure with that in mind. For the first 24-48 hours, it's going to look too much. You're going to look in the mirror and think, oh my goodness, what have I done to myself? But within that first 24-48 hours, that initial dramatic swelling comes down, and within 2 weeks, the whole thing's completely settled into place. So you really want to give yourself a couple of days. One of the other key things with lip augmentation is that when you have it done, you quite often forget what your lips look like beforehand. And a few months later, the filler's all, in your head, the filler's all gone and you're back to the way that you were before. That's one of the biggest mistakes that people make with filler. They then go back and they top up too soon, and they've still got the filler from the first time, and they're adding more and more onto it, and you get this build up of product, and you end up with something that's overly enlarged and doesn't look attractive. So I advise patients never to do this more than once a year, and sometimes even as much as 18 months, depending on how long your body holds on to the product for. There's a couple of ways that we can numb the lips up beforehand. We can either inject a local anaesthetic inside the mouth, which makes the whole mouth go completely numb. The alternative way is just to use some numbing cream to numb the surface of the skin. When we do that, you still get the odd little nip as the needle goes through the skin. Most people tolerate that quite well, but if Siobhan does struggle as we're doing the procedure, we can always stop and put in a dental block as we go along. So we are using a product called Juvederm Vollift. All the fillers that I use consist of hyaluronic acid because it's reversible. You can inject an enzyme which dissolves the product and it's gone if you decide that you've changed your mind or if you develop a problem with it. This is a really nice smooth filler that's quite light, which I really like for injecting into the lips. I find that it gives a really nice soft and natural result. We're going on the assumption here that Siobhan wants a natural looking result that no one's going to be able to spot as a lip augmentation, which is what 99.9% of the women who come here want to achieve. And to get us that sort of result, there's a few little techniques that I use to make sure that it looks as undetectable as possible. The most important thing is how the lip moves, because you can make a lip look really nice in the photograph, but as soon as it moves, you can see that it doesn't move properly. To avoid doing that, the whole filler has to sit in a nice even sheet directly on top of the muscle. When you have filler injected within the muscle fibers, as it moves, it tends to distort the filler. You can sometimes get little lumps and bumps appearing, and we really need to avoid creating that. So the way that I do that is by using something called an antegrade injection technique. So what that means is that instead of just inserting the needle in and then injecting on withdrawing, what I'm actually doing is getting the tip of the needle to sit in that precise tissue plane, and then very slowly injecting the filler and let the filler find its own path forward in that very precise potential space between the skin and the mucosa. My preference is actually to go in perpendicular to the lip, and the reason that I do this is because as well as the filler flowing along the border of the lip, it also flows down and into the body of the lip as well, which gives me a really nice eversion to the lip. The needle's just going into that potential space. I can feel that I'm in the right space, and you can see that just as I'm injecting, slowly the filler's spreading out from side to side and down into the red part of the lip. Okay, so I put most of the volume in the central 2/3 and then just a little bit over laterally. Again, perpendicular to the skin and watching the filler flow forward. Looks good. So we have just finished doing the lip augmentation procedure. It took about 5 minutes in total to do. A couple of little nippy bits in the middle, but Siobhan tolerated it really well just with the cream. If she'd been finding it more uncomfortable, we would have converted to a dental block so that she didn't feel anything. Right now it is a little bit Mick Jagger. It's a bit swollen and puffy, which is exactly what you'd expect at this stage, but over the next couple of days, that initial dramatic swelling and puffiness will come down, and the important thing is that the proportions of the lip are going to be in balance, and the actual filler itself is going to look nice and smooth, so it will actually look like a really nice natural result. It just needs a couple of days to settle.
They look good though.
They look amazing.
I thought I was going to get a fright, but no. Thank you, Darren.